Menopause does not hit Black women the same. And if your doctor told you that it does, they're wrong. If you're having stronger hot flashes, worse sleep, mood changes that feel out of control, or menopause symptoms showed up earlier than you expected, it's not in your head, and it's not because you're not handling it well. Decades of research show that Black women enter menopause earlier, stay in the transition longer, and experience more severe symptoms. But we're the least likely to get treatment. I'm Dr. Janet Williams. I'm a board-certified obstetrician-gynecologist, intimate health coach, and hypnotherapist. I help women over 40 navigate perimenopause and menopause and get their pleasure, their intimate lives, and their relationships back on track. I'm going to spend a little bit of time in this video to break down why menopause is different for Black women, what the research actually says, and what you need to know so you can stop suffering in silence and start advocating for your health. Before we jump in, make sure to subscribe to this channel and share this video with someone who you know needs this information. When you subscribe to this channel, it can not only help to change your life for the better, but it can also help other women to find this information and get the help that they need. So let's get into it. First, a quick menopause refresher. Menopause is officially diagnosed when you've gone a full 12 months without a menstrual period. The average age for menopause for women in the United States is about age 51. But for Black women, research shows that menopause can start earlier, symptoms tend to be more intense, and the transition can last longer. And that comes straight out of decades of high-quality research, including the SWAN study, which was one of the largest and longest-running menopause studies that we have. Studies following thousands of women over more than 25 years have consistently found that Black women enter perimenopause earlier, reach menopause between 8 and 12 months earlier than white women, experience more frequent and more severe hot flashes and night sweats, have higher rates of sleep disturbance, report more depressive symptoms, and stay in the menopause transition much longer. And one thing that really stands out at baseline is that Black women report more hot flashes and more night sweats at even higher rates than white women, even prior to menopause and the onset of perimenopause. And even though Black women are more likely to have more symptoms, we're less likely to report them to our doctors, less likely to be offered hormone therapy, less likely to receive any kind of mental health support, and less likely to get adequate treatment. And when we do bring our symptoms up, they're more likely to be minimized, diminished, or attributed to stress, weight, anxiety, or quote-unquote just getting older. Sound familiar? So why does menopause hit Black women harder? The research is very, very clear on this, and it's driven largely by social and structural factors. Things like chronic stress, everyday discrimination, racism-related stress, differences in access to healthcare, differences in the quality of healthcare, economic stressors, and caregiving burdens. In other words, your hormones are responding to the environment that your body has been surviving in. And we know long-term stress affects cortisol. Cortisol affects estrogen. And estrogen affects your brain, your sleep, your mood, your metabolism, and your heart health. And so let's talk about heart health for a second because this is really critical. Before menopause, women generally have lower cardiovascular risk than men do. But after menopause, that risk goes up pretty sharply. Estrogen has anti-inflammatory and protective effects on our blood vessels. When estrogen declines, inflammation increases. And that's really important when we're talking about heart disease. And here's the issue for Black women. We already have higher rates of hypertension, higher rates of cardiovascular disease, higher levels of chronic inflammation that are related to stress. And so when perimenopause and menopause symptoms show up earlier, our cardiovascular risk also shows up sooner. And that's why menopause and perimenopause is not just about hot flashes. It's about long-term health, our longevity, and then our quality of life. Despite all of this, Black women are half as likely to receive treatment for their menopause symptoms. Yes, half as likely. That includes hormone therapy, assistance with sleep support, mental health support, and sexual and libido health care. And part of this is medical bias. Part of it is the lack of education of healthcare professionals. And part of it is just how Black women have been conditioned to push through, power through, and just deal with our discomfort and our pain. But perimenopause and menopause are not the time to be strong and silent. So what do we do with this information? Number one, we want to normalize the conversations. If you're having hot flashes, mood changes, libido changes, brain fog, we need to talk about it. Second, we advocate, asking direct questions, writing down your symptoms, writing those symptoms down and bringing them to your doctor's visits, asking about all of the treatment options, not just being told to lose weight or to do some yoga or breathing, all of the treatment options, medications, hormones, other therapies, alternative treatments like cognitive behavioral therapy or hypnosis, and getting second opinions when you need them. And third is to stop internalizing this struggle that we're having as something that you've done or internalizing it as a failure on your part. You didn't do anything wrong. This is biology. This is physiology. This is a normal, natural process. And with the additional stress of being a Black woman, your body is responding exactly as it was designed to under long-term stress and hormonal changes. Menopause is a biological transition, but how it shows up for you individually and in your body depends on your lived experience. And for Black women, that experience often includes carrying more stress with less support. So if menopause feels more intense to you, overwhelming, or confusing, you're not imagining it. You're not being dramatic, and you're definitely not alone. This time of your life requires and deserves education, compassion, and real solutions. So if you've been suffering with menopause symptoms like hot flashes, low libido, problems with your sexual health, or just not feeling like yourself, and you're ready to get your pleasure, your health, and your life back on track, check the link in the description to learn about the system women over 40 are using to navigate this transition, to wake up their pleasure, and to live their best lives now and for years to come. Thanks for watching, and I will see you soon.